From the JAMA Network, this is the JAMA Medical News Podcast, discussing timely topics in clinical medicine, biomedical sciences, public health, and health policy, featured in the medical news section of JAMA.
On today's show, we're discussing practice-changing updates to lipid guidelines in the U.S. I'm Kate Schweitzer, Associate Managing Editor of JAMA Medical News. News Director Jennifer Abbasi is here to talk about her story. Hi, Jen.
Hi, Kate.
So, Jen, a few weeks ago, the American College of Cardiology and the American Heart Association released new consensus recommendations for the management of blood cholesterol and triglycerides. How much do they differ from previous recommendations?
I'd say a lot. I covered the guidelines the last time they were updated, which was 2018. Since then, new research has come along that has led to some major changes.
Okay, so would you say there's an overall theme to the recommendations?
Yes, there's a clear through line, which is earlier recognition of atherosclerotic heart disease risk and earlier intervention through lifestyle modifications and, when needed, medication. And as the chair of the guideline writing committee, Dr. Roger Blumenthal from Johns Hopkins told me, when it comes to LDL cholesterol, lower is better for longer.
Tell us about some of the big changes.
Sure. So the guidelines now say that the first lipid panel in adults should be at age 19, and then lipid profiling should be done at least every 5 years in young adulthood. And even before that, all children should be screened with a lipid panel around the age of 10 to identify cases of familial hypercholesterolemia, and in some cases even as early as age 2. And as for lipid-lowering therapy, the guidelines advise starting statins at age 30 for patients with LDL-C levels at or above 160 milligrams per deciliter, or patients with a strong family history of premature ASCVD or a high 30-year risk, even if their 10-year risk is low.
And there's also news about that risk estimation.
That's right. The new guidelines adopt the AHA's Prevent ASCVD risk calculator, which replaces the older and less accurate pooled cohort equations. Using this new tool, clinicians are now advised to start 10-year ASCVD risk estimation at age 30 instead of 40. And for patients in their 30s, 40s, and 50s, clinicians should also calculate 30-year risk. This can help motivate healthy lifestyle modifications and guide treatment decisions for people who are in a gray zone of 10-year risk. And with the new calculator, the risk categories have been recalibrated, and lipid-lowering therapy should be considered now for patients with a 5% to 10% risk over the next 10 years.
And there are also changes in goals for lipid-lowering therapy.
That's right. The LDL-C numbers to remember are 100, 70, and 55. For the general population, their LDL-C levels should be under 100. The target is less than 70 for patients without clinical ASCVD who have high risk based on PREVENT. And for most patients with clinical ASCVD, it's under 55.
Okay, another big change has to do with lipoprotein A, otherwise known as Lp(a).
Yes, the guidelines now recommend one-time testing of lipoprotein A in all patients to identify those at greater risk of ASCVD. And that's because elevated Lp(a) levels are associated with enhanced cardiovascular risks. We'll know more about whether it's a causal relationship later this year when trials testing the effects of Lp(a) lowering on heart attacks and strokes are expected to start reporting out. And there's also greater support in the new guidelines for consideration of apolipoprotein B testing and coronary artery calcium scoring to help guide medication decisions. Dr. Blumenthal called the CAC score the best tiebreaker we have for deciding on treatment initiation. One other important update I'd like to mention is that now, in addition to adults with diabetes, statins are universally recommended for patients with stage 3 or 4 chronic kidney disease or HIV between the ages of 40 to 75 years, and that's regardless of their LDL-C levels.
Thanks, Jen. If you'd like to learn more about these new guidelines, we'll include a link to Jen's story in the show description. This week, we also published a story I wrote about a call to increase awareness about heart attacks in younger women. You can find that and all of our stories at JAMAmedicalnews.com. I'm Kate Schweitzer. This episode was produced by Shelley Steffens at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening, and join us again next week.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.